Hey, everybody. I am here with Steve Ingel. And the reason we're here is because, this crisis, people say it creates things. I've heard crisis just accelerate things. And one of the things that accelerated is the drive to connected medicine. We call it telehealth, whatever, connected medicine, because with distance, social distancing required, limited amount of time, it's becoming more important and accelerated. And I'm here with Steve because Steve has been working in this area for many years and actually just won the Edison Award for Innovation in Healthcare for the MotionMD platform that helps create that connected health and medicine. So I've got Steve Ingel here with me. Steve, I appreciate you taking the time. I know there's a lot of interest in this subject.
Hey, Joe, thanks for having me today. Good to see you and happy to be here.
Great. Well, hey, I know everyone, I know you well. We've had a lot of water under the bridge together, but tell me a little bit about you and the MotionMD platform for those that don't know what it is and who you are.
Sure. I head up our Healthcare Solutions division at DJO. I've been in healthcare for over 30 years, and as you know, at DJO, quite a bit of time. And it's been a great run in healthcare from early start as a distributor carrying the bag, owning my own distributorship to years in the manufacturing side, whether it's in the orthopedic side of bracing products, surgical products, rehabilitation products, and now kind of made a switch a few years ago from really the device side of what I would say is our business into the solutions side of our business, which encompasses a lot of things. When I define solutions, it's being well contracted, having access to customers through national contracts. So that's under my team. Whether that's business model solutions that have you deal with other things beyond just a product, or automation solutions which underpin our products or business or connect customers and patients. So it's been a real steep change for the company. 3 years ago when we moved into this, it was a move from being purely a med device manufacturer to how do you take a more solution-based approach to an ever-changing healthcare market.
Yeah, it is. And it was already, like I say, it was already kind of going there, right? And now with kind of the expansion of remote care where people can't get into the office, I mean, what areas of connected medicine are going to change healthcare for good, in your opinion, Steve?
Yeah, it's interesting. It's funny. I read a quote the other day from the CIO at Cleveland Clinic, and it says he said distinctly, "Embracing change is going to be critical for everyone. The same old way of doing things is probably not going to be the path forward." The adoption of digital telehealth across healthcare accelerated 4 or 5 years as a result of COVID, and it isn't going back. And so if you think about even pre-COVID in the last 2 years, the amount of dollars chasing technology in healthcare was in the 7 to 8 billions. In the first half of 2020, even in a COVID environment, it's even beyond that. They're looking at about 9.1 billion chasing technologies in healthcare. Why? Well, all COVID did was remind us that we have an industry that's far behind where many are. I mean, how can you do your banking online in 5 minutes, but you have to take half the day off to go see your physician, right? That's illogical. And at a time right now where access is an issue during COVID, even more of an issue. So the ability and the necessity to adapt to an environment where you have to connect with your patient in many different ways. You have to assess your patient potentially remotely and deliver devices or healthcare in a means different than we ever had. And COVID, all that's done is brought that forward and in a more urgent manner than ever before. And really for us, where we started with MotionMD was really about enabling the transaction, right? So we, at our core, play in the durable medical equipment space in one of our largest business units, right? And that's, and Joe, you've been in the business, the ability to build that and the processes and workflows behind that on paper are brutal, right? And it doesn't matter whether it's a wheelchair, a commode, a brace, or something else, it's a brutal process on paper. And so what we really endeavored to do was digitize the transaction and to create a compliant, seamless experience that is completely digital from order to cash, right? The entire revenue cycle around billing this transaction, because at its root, healthcare is a business, right? Yeah. And when you take devices that need to get on patients and keep them moving and get them back to health, there's a lot in that, between the inventory, the entire workflow of making sure the patient has insurance, has met a deductible. With the onset of the Affordable Care Act, sure, more people had insurance, but it sparked up the single greatest impact, which was high deductible health plans. Yeah. So now you have a lot of patients showing up under the auspices of having insurance, but really they have catastrophic care, but the first thousands of dollars are out of their own pocket, and it's created this massive issue for healthcare and the patient that, it's healthcare consumerism at its finest. Yes, you have insurance, but the first large portion's coming out of your wallet. So as a provider, if you're not understanding that up front, you are at risk on the backside. If you don't get your money right up front for the device or the care, you're chasing patients for cash, which is not a real good outcome, right? And so that's why bad debt is increasing on the books of hospitals and clinics. And so really you've got to create a more efficient process. And so that's really what MotionMD was about, was to digitize the entire encounter, make it a seamless process for either providers who have elected to do the billing themselves or who have outsourced it to folks like DJO, where we do both. And enabling that transaction in a more efficient, compliant manner is really what allowed us to connect better, and doing it inside of their operating environment. For those on here, I don't know if they know what an EMR is or an EHR, but it's really the platforms under which hospitals and clinics are operating on, right, and a requirement of healthcare. And so if you're going to stack up a technology solution, you have to be able to connect to that operating environment in the clinic. Mm-hmm. Every day we get approached and we see other technologies in space that are great technologies by great technologists, but they've missed one big thing. You can't have these clinics and hospitals trying to run that on a separate operating system or application that isn't operating with their current operating environment. And so this whole concept of connected medicine or digitization or automation, it's critical you understand the workflows of what's going on in these locations. Patient care is a lot different than any other environment, and how those clinicians and providers operate in their workflows and tying into that is critical. And that's really one of our core competencies on our platform. We've been able to do that well, install it even remotely. And that's one of the things that enabled us through COVID, where you couldn't physically get to customers because of their own rules about having folks outside of their own clinic space operating their clinics during COVID. So being able to install that remotely, being able to work within the workflows of their operating environment is critical. And, one of the things that happened is patients can't go to clinics right now, or couldn't. And some have opened, some are still restricting access. Some of those patients are right in the bandwidth of the highest risk population. They don't want to go to see their doctor. They're afraid. They're in this risk category. But how do you then do a telehealth visit, say on an orthopedic device, where they need a brace, and how do you get it to them if they're not physically in front of you? So we pivoted to create a telehealth module that allows the doctor to assess the patient through telehealth using their own telehealth modules, but then deliver the product to them through MotionMD compliantly direct to their home with fitting videos. They can sign for their insurance electronically, all of it designed to seamlessly deliver healthcare and a device to the patient in their home through a remote telehealth visit from their physician. And so just an example of, adapting to a changing world, adapting to a world that turned upside down with COVID. That's one of those things that we did. And I guess the other part of what the industry is seeing is that, you've seen CMS and Medicare expand their reimbursement, take down some of the rules around what you have to do to enable more telehealth visits at a time where it's critical for their, look, Medicare, CMS is trying to see Medicare population. A Medicare population is an older at-risk population, so they have to enable more telehealth to keep Medicare beneficiaries safe, right? And so they've definitely expanded the rules, taken down some of the barriers to deliver a telehealth visit. The private payers have adopted some of that. Some you've already seen are scaling that back. I think as private payers will do, they want to make sure it's being delivered correctly, because at the end, they're running a business. But I think what you're seeing out of this, and clearly indicative of the private equity dollars solutions, the amount of energy, the amount of telehealth visits that spiked up, is that COVID, accelerated this whole connected medicine piece.
Yeah, absolutely. Yeah, some really interesting points in there. I mean, at HIMSS this year, they talked about one of the key elements of most concern was interoperability, right? And being able to make sure everything talks, so their one platform works together integratedly. And that's a value you brought. I thought it was an interesting point. I mean, if healthcare is more, if patients are more of a consumer and they're paying out of cash, now they've expected to be able to have easy access operations. I mean, the banks taught them how easy it can be. That experience isn't right. They're probably not going to want to pay as well if they didn't like the experience. So that healthcare consumerism, or they might go somewhere else. So some really
and to me, we launched a module called VeriPro. We piloted it with a number of customers, because we always get VOC either from customers who are doing it service line themselves, or we're the But think about it, in what industry outside of healthcare? I mean, you don't roll into Best Buy and buy a TV and then get the bill 3 months later and wonder what you're going to get charged. So, you have to deliver. And in fact, if you saw the recent HHS changes, come next year, hospitals are going to have to provide transparency to patients of the cost. So we created a tool that gives, we can scan a patient's insurance right through their EMR, and within 5 to 15 seconds give them a distinct number that they would owe right there against their deductible real time. What does that allow? It allows the patient to make an informed decision on their care. It allows the provider to provide clarity to that patient about what the cost of care is. And so they don't have to leave without that care, without that device. They don't have to wonder, the provider doesn't have to wonder whether they're going to be able to collect. The patient doesn't have to wonder whether they can afford the device or can get the device, or whether it's covered. And that kind of transparency is what a consumer expects in any space. Why should it be any different in healthcare? And that creates a better patient experience and a better patient outcome, because at the end, you don't want the patient to leave without the device or treatment they need. Otherwise, you're just creating other issues in terms of their care.
Yeah, good point. You mentioned, Cleveland Clinic, they're going, that this is accelerated connected medicine 3 to 5 years is what the gentleman said. So that's a big change. So how does, a medical device company, how would you recommend they adjust to these, acceleration of change?
Yeah, I think it comes back to, we're a leader in our space, right? We have leading brands in a lot of the spaces we operate in. We're the 7th largest orthopedic company in the world. The 6 in front of us primarily get through total joints. We happen to cut across the whole care continuum. And so we have a pretty unique lens to that. Mm-hmm. But I'd say this, for any of the companies, our big sea change, and me even taking this healthcare solutions thing, is to realize that even with brand name, some of the table stakes right now are your products. That these customers expect that if you're at the table talking to them, that your products do deliver on their promise of a better outcome for a patient or what they're intended to do. Now, what else are you going to be able to do for me? How are you going to help me deliver more efficient care, more effective care in a challenging time? So I think that if you're sitting as a manufacturer of other product, what other solutions or things can you bring that enhance your product? What other things can you do beyond just the clinical efficiency and effectiveness is critical, right? We treat patients. But what other things are you going to deliver around that product for the total cost of care, to enable the care continuum, to enable remote, potentially access to those products? And so I just think you got to think through it beyond just what today's four walls are. Our solutions conversation actually wins us more of our business than our product conversation right now. And it's because you're having to deliver more value to a provider. If you think about it right now, post-COVID, what's going on out there for hospitals and clinics? Their P&Ls have been annihilated, right? Cash is king. Delivering healthcare in a more effective manner. How are we going to do that when they have to spend more money to ensure their facilities are safer to bring in the same patient populations that they were treating yesterday? So if you think you're going to show up with the same story as you did even 90 days ago, you're not, because they need more help, because their P&Ls are under attack, and they got to figure out ways to be more effective and efficient in delivering care. Period.
Yeah, makes total sense. So how's DJO bringing that commercial value? You mentioned a couple of the key things you've done. You pivoted to where it's, we're able to connect into their telehealth systems, et cetera. What are some of the other areas of value that DJO is?
I think our opportunity now is, look, we've really scaled the MotionMD platform, the one that we won the award for, and that is scaling because we built it off of fundamentally solving a business problem, right? The transactional problem that at the end helps providers, deliver the service line more profitably, more effectively, with a better patient experience. And now the opportunity is, given we are connected to their EMRs, is to stack up clinical engagements, clinical pieces that connect on the patient side. And we've begun to do that. I'll give you an example, total joints, right? In the total joint space, which is, implants of knee, hip, shoulder, right? Which is a large portion of the U.S. population that is going to need this care. What's happening?
Single largest Medicare spend. Yep.
Single biggest Medicare spend, 70 million baby boomers, many of which are going to need a total joint in the next 15 years. But as you've seen, what's happened from a cost, there's not enough money in the U.S. health system to treat all these patients, right? And so what's the big move? The big move is to move those patients from a hospital stay, 2-day, 3-day stay, which is very costly, to a same-day discharge, and likely to the ambulatory surgery center where the procedure is done and they're discharged same day, right? Now think about that in a post-COVID world. Are you going to want to go as a at-risk Medicare patient and spend 3 days in a hospital that treated COVID? Or are you going to probably be more likely to want to be in an ASC, right? And be in and out same day. And so what's that opportunity? We created a device called the Aura Score, which basically assesses a patient's health scores to give them a predictive determinant. We studied it with ICGR and CCGR, the governing bodies, and it gives a more predictive outcome as to whether that patient is a good candidate for same-day discharge. Low obesity rate, not a lot of comorbidities, things that you would say, wow, that's an at-risk patient. We can't send them home. They'd be at risk for rebound, for failure from a number of things, pain, DVT, sterility, just their underlying health measures don't require it. So we created a scoring system. We've stood up a connected knee brace so that when the patient goes home, we can now monitor and track their progression through rehabilitation. And if they turn red, as an example, they're not doing their work, they're not doing range of motion, all of a sudden you can intervene quicker as a clinician because you're seeing real-time results onto the system through the cloud. We have a platform called Motion IQ that's connected to MotionMD, where we take the patient from prehab to rehab through the entire process of rehabilitation. and that way they're shepherded through with a bunch of videos and other things, and the clinicians can intervene real time in their care remotely. And we've created a registry where you can now dump in all of the data across their procedure for an outcomes view. So think about it. In this case, we've created an environment where you assess the patient upfront for their whether they're the right candidate to be in an outpatient setting, and document that, which is critical for Medicare compliance. We've created an environment where we can take them from prehab to rehab, so they're prepared, and it tells them what to do after surgery, post-surgery. We have a connected device that tracks and monitors them, so we know whether they're progressing in the condition through their rehab work, the range of motion, and then an ability to dump the data out of that into the registry. Because why is that important? Data is king for providers to show that their procedures provide the right outcome. When they go to payers, they can get paid properly for the outcomes they're generating, right? Because all of this is about generating the right outcomes and having the data to do it. So for us, our MotionMD platform, which was focused on the transactional side and will continue to be and continue to progress, has now moved into a clinical continuum of care, and will continue to add to that across the care continuum of products that DJO does, because we intervene in so many types of orthopedic procedures, but we're able to enable that on one platform tied into the EMR EHR. So it creates this kind of seamless move from transaction to clinical care.
That's great. And to be able to pull that data out, to easily create a registry and aggregate and get to that, what is that best practice? What's that best prehab to rehab has the best impact, so they can be better in servicing their patients. And with shared risk contracts coming out, I'm sure, and especially in the ortho world that's growing and growing, that's going to be really welcome. So great example how that connected medicine is able to really work through that entire continuum of care to make impact. It's powerful stuff. So I got a little bit of time here, and I'd like to take some questions here from anybody on the FloodGate family that's put some things out there. So which segments of healthcare do you think will be most impacted?
Yeah, I think you've seen the early adoption a lot is in cardiac care. And I think if you look at some of the technologies that already exist in there in terms of remote connected medicine, just look, there's a lot of technology already in space from some of even the larger and smaller companies intervening in cardiac care. I mean, look, you've seen, what Apple has done just on its health piece. Medtronic has things. There's a bunch of big names out there already intervening. And the reason is you can get that feedback fairly quickly from a cardiac patient. You got to be careful, right? Some of the things that the clinicians will tell you is you can't, if you react to everything, you're reacting to everything, and not everything needs to be reacted to. But I think if you look at the cardiology space, if you look at the diabetes space, companies like Dexcom or Abbott who've created remote monitoring. Dexcom is one here. I'm based in San Diego based. They got approved, the only one, because they're cloud-based for COVID patients, because that is a comorbidity where a lot of folks have unfortunately died from having diabetes associated with COVID, but they can take a reading on that patient remotely in the ICU, load it right into the cloud, and that nurse does not have to physically touch the patient to get a reading during COVID. Pretty important, right, in transmission and getting to them. So those are just some, examples of what you're seeing. Clearly, orthopedics, there's a lot of interest chasing it. The real reality of orthopedic care is, do you need a physical assessment to see that damage done in the knee and really see it? But there's a lot of things that can be intervened, post-care, where you've already diagnosed and now you're just doing check-ins, or you may assess it and you don't need to go farther with a physical assessment. But I think you're going to see it cascade across every area. But the two that I've seen the most so far and three really are cardiac, diabetes, and orthopedics.
Yeah, good. How do sales teams adjust? If you're a seller out there, what adjustments should they make?
It's that's a great loaded question, because I would tell you, we've spent as much time changing the mindset of our own internal sellers as we are addressing customers' needs. And the reason is, as you know, Joe, because you've been a widget salesman in your past, reps like selling widgets, physical things that you can put in front of people feel a lot better. I think they get very afraid of the conversation around software and technologies only because it's an unknown. So I think the key is to make sure you're constantly educating your sales force, really educating them on what that customer is looking for. We, funny enough, created, we were fortunate enough, we did a video with a customer where we were piloting our VeriPro solution for patient, upfront verification of benefits called South Shore Orthopedics. And they did a great job, and they filmed a video. They loved the tool so much, they filmed the video for us. And funny enough, when we put that video in front of our sales force, that resonated better than anything, that the words of a customer that they could see on video. Why is YouTube big? Because people learn in different ways right now. And conference calls probably aren't it. And so, especially with COVID, seeing a customer talk about it and it's been impacted them, and the fact that it was the solution that underpinned the reason they chose DJO for its products, that's a powerful message. And it's really about moving people away from just a product-based conversation to a solutions-based conversation. But for anybody watching, I wouldn't underestimate that challenge, especially if you have long tenured sales forces that have been selling product for a long time. It takes them some time to gain confidence and understand that it's a different conversation.
Great suggestion. In fact, I had some questions on the VeriPro. And so is there a link or a place that maybe that video, if it's public, that we might be able to, share, or where would you point people to?
Yeah, you can go right to DJO's website, and you can link right to MotionMD and VeriPro from the website. The video's right there on the website.
Awesome.
DJOGlobal.com.
Okay, perfect. And really to get also more information like this, other opportunities and information about what DJO is doing in orthopedics, follow us on LinkedIn. I know we're both active, posting a lot of our information and successes and questions out there. So please follow both companies. And I appreciate it, Steve. We are at our top of our half hour here. So thanks for taking the time. I mean, I know I learned a lot. Absolutely impressed what you did. Congratulations on the awards. No question, it's well deserved. It's been a long time coming. So I look forward to catching up with you soon. Thanks for the time today.
Thanks for having me, and always a pleasure to see you, my friend. Thanks so much.
Thank you. Bye-bye.
Bye-bye.